But patient positioning is only one piece of the puzzle. To be able to make radiation therapy work in the upright orientation, we have to be able to image the patient upright as well. And this is where the integrated CT functionality comes in. Once we have the patient set up in their comfortable, optimized posture, we bring the CT ring down around the patient, noting that the angle of these arms on the side is always parallel to the direction of the backrest. So we're always imaging with the same imaging planes that we typically see in radiation therapy today. So the imaging ring comes down around the patient based on their indication and is acquiring an image as this goes back up. And this is not a cone beam CT. We're really pushing the boundaries in terms of the image quality at isocenter. This puts all of the power back in the hands of the radiation therapist to truly see the internal anatomy and truly see the tumor volume that we're treating. What this also allows us to do is push the boundaries of online plan adaptation. What better scenario to have the same imaging modality, the same imaging system at the treatment isocenter as was used for simulation imaging. So we're imaging the patient at that treatment position, and the final step, and really the key to the success with this technology and the key to unlocking global access to proton therapy, is our ability to very, very slowly rotate the patient in their optimum posture in front of the fixed beam. And if we think about going back to conventional proton therapy, that used to be done by taking 100 tons of equipment and rotating it with respect to a 100-kilo patient. We flipped radiation therapy on its head, and we keep that 100 tons of equipment fixed, and we very, very slowly rotate the patient instead. And this is the breakthrough. Such a simple change, but something that allows us to go and take proton therapy, the clinical advantages that have been proven at centers like the McLaren Proton Center for many years, but put them truly on a global stage. So thank you for joining us at the McLaren Proton Center here in Flint, Michigan. But what's next for Leo Cancer Care? This is the first step in the journey to be a more human way to deliver radiation therapy. Proton therapy is coming this year. This is not a 5-year horizon. Leo Cancer Care will be treating patients with protons in 2025, but that's not where we're stopping. Leo Cancer Care is committed to bring all of the financial, clinical, and emotional benefits of upright radiation therapy to the entire oncology space. We're going into proton therapy, carbon ion radiotherapy, photons, flash electrons, BNCT. All of these different modalities are being enabled by the power of upright.